Welcome back to the Aspire podcast series. I'm your host, Yeji Lee. Today, our guest is Norman Weiniger, a licensed mental health professional that has worked with Aspire for many years. Welcome, Norman.
Thank you, Yeji.
Norman, May is National Mental Health Awareness Month. It's a month dedicated to bringing awareness to mental health. In honor of this month, we want to discuss the prevalence of mental health conditions and how we can recognize some common symptoms of mental health issues. Let's start off with how common are mental health conditions?
Yes, so happy we could be discussing this today, Yeji. Mental health conditions are really quite common. The World Health Organization, for example, tells us that approximately 1 in 4 people worldwide will experience some type of mental health condition at some point in their life. In fact, the WHO also tells us something about the impact of these conditions in that an estimated 12 billion working days are lost each year due to just two mental health conditions, depressive disorders and anxiety disorders. Now, when you think about how common they are, Yeji, we think about how that varies depending on the type of condition and the population that's being looked at. For example, some of the most common mental health conditions include depressive disorders, anxiety disorders, bipolar disorders, post-traumatic stress disorder, among others. Now, closer to home in this country, according to the National Institute on Mental Health, in any given year, about 19% of American adults experience an anxiety disorder. It's very common, and approximately 10% experience some type of depressive disorder. In a recent year, 2021, about 58 million people, or 23% of all U.S. adults, experienced a mental health condition. 58 million, 23%. Yet that's more than the total population, I believe, of two populous states, Florida and Texas combined. So it's a lot of people. Gives you a sense of how common they are. And fortunately, these are largely treatable conditions. It's important for us to understand, speaking of treatment, that too often these types of conditions go undiagnosed and they go untreated. So the actual prevalence of mental health conditions may be actually much higher than what's commonly reported. Excuse me. Unfortunately, though, Yeji, you and I know that two common stereotypes about mental health conditions exist, and they're often around an image of what mental health professionals call severe and persistent mental illnesses. An example being schizophrenia. These are conditions that can significantly impair people's thinking and their perceptions. But these severe and persistent mental illnesses affect only about 1% or so of the population. And even these conditions today can be diagnosed and treated more effectively than ever. So the point I'm making is that stereotypes around mental health conditions create a barrier to people seeking and getting assistance for these types of conditions.
That's very insightful and important information, Norman. Can you describe some of the more common mental health conditions and some signs that one might be having a symptom of a mental health condition?
Certainly, let's jump into that and talk about common mental health conditions and some of the signs of a mental health condition. There are really many different types of mental health conditions, each with its own set of symptoms and treatment approaches. So, some of the more common ones are anxiety disorders, depressive disorders. And in fact, these two, Yeji, anxiety and depressive disorders, can be a bit confusing because those terms are both symptoms and uh, in their milder states are common feelings that people have throughout the course of their days or weeks or lives. After all, who among us doesn't get a little anxious at times, or maybe have a low mood at times? So it's important to keep in mind that anxiety and depression are both symptoms as well as types of conditions. In other words, they can be symptoms of other types of conditions. Another common one is bipolar disorder. And another one might be post traumatic stress disorder. And really, also in that general category of mental health conditions, we would also include a variety of substance misuse conditions. Now, let's talk about what are the signs or symptoms of mental health conditions. And there's kind of 5 areas to think about when we think of signs and symptoms of mental health conditions. First one is changes in mood. For example, feeling sad, hopeless, uh, feeling very anxious, irritable, angry, or sometimes feeling what is described as feeling numb. And all of these would represent things to be looking for when there is a change in feeling states, and normal feelings, if you will, start to be influenced by these feelings that I just described. Now, there's also another area is looking at changes in behavior, because mental health conditions can not only affect our mood, can also affect our behavior. Examples of that might be maybe withdrawing from social activities, possibly avoiding work or avoiding school, possibly using alcohol or other mood altering drugs to cope with stress or cope with a situation, even engaging in self harm type of activities, or experiencing changes in eating patterns and sleeping habits. For example, difficulty falling asleep. So, changes in mood, changes in behavior. Another area is changes in how we think. Examples might be having racing thoughts or having disorganized thoughts, possibly having trouble concentrating, or feeling paranoid or very fearful. Another area is physical symptoms, because mental health conditions can affect us physically as well. Examples of that might be feeling excessively or overwhelmingly tired, having headaches or stomach aches, experiencing changes in appetite or weight, or experiencing chronic pain. So, another and final of the 5 areas that I wanted to mention today would be emotional symptoms, and that is feeling overwhelmed, having difficulty regulating, which means managing our emotions, experiencing intense feelings of guilt or shame, or even feeling detached from one's emotions. So, changes in mood, changes in behavior, changes in thinking, some physical symptoms, or these emotional symptoms. So those are some of the signs and symptoms of emotional mental health conditions in general. Now, it's important to note, Yeji, that experiencing any of these symptoms doesn't necessarily mean that someone has a mental health issue. However, if the symptoms that I described persist, begin to interfere with daily life activities, then it's important to seek professional helps. And sometimes that professional help begins by starting with your employee assistance program. A mental health professional in the employee assistance program or in other settings can provide an accurate diagnosis, educate you about the condition, and help to develop an appropriate treatment plan to address the issue.
What are some ways that we can support people around us if we suspect that they are experiencing a mental health issue?
Good question. If you suspect that someone you think is experiencing a mental health issue, there's several ways to help. One is to offer your support by being a good listener. That may be the most important takeaway in response to that question, Yeji. We encourage people to do that, to be a good listener, to don't judge people, and particularly don't feel that you have to have an answer or a solution. Be a careful, intentional listener. When you can, suggest how they can get further assistance. If a person is having thoughts of harming themselves or others, of course, stay with them, but connect them to emergency intervention services like the National 988 crisis hotline or call 911. Second thing that people can do is educate themselves about mental health issues like our listeners are doing today. Overarching things to keep in mind is if you're concerned about somebody that might have a condition, be supportive with them, for them in their path to getting additional help or treatment. Often that can start, as I said earlier, with their employee assistance program. Excuse me, remember that while you can offer support and encourage someone to seek help, ultimately the decision to seek treatment is up to that individual. You want to respect their decisions and boundaries while continuing to offer your support and encouragement.
That's great information, Norman. What are some resources that are available to us in times of a mental health issue or crisis?
Well, there are actually several resources that are available to help individuals experiencing these issues. Here are some common ones. One that comes to mind would be your trusted primary care physician or primary health care provider. Um, as I mentioned, uh, that can be a great starting point. They can assess your mental health, I should say, and screenings, and they can provide you with resources for treatment or other specialized mental health services as needed. And I mention that because many people have positive relationships with a trusted primary care physician or their primary health care provider, and that can be a good starting point to discuss these kinds of issues and symptoms. Second type of resource are mental health professionals. Mental health professionals include folks like a psychiatric physician or psychiatrist, clinical social workers, professional counselors, marriage and family therapists, clinical psychologists. All of these types of professionals can provide a diagnosis, treatment, and support for mental health conditions. Another resource I like to mention, because they are accessible to so many people, are support or self-help groups that are found in many communities. They're a way for people who had common experiences, Yeji, to come together and share their experiences and share how they are managing and coping and overcoming them. They also, as you can imagine, provide positive relationships and a sense of togetherness and a lot of mutual support. They often have a focus on issues like managing grief, uh, managing transitions that we go through in life, or recovery from addictions. There are a lot of digital resources, an increasing number of digital channels, in other words, for mental health support. And there are a variety of apps, mobile apps on mental health issues, on mindfulness, or on well being. And people can check those out because they provide a different channel and a lot of different ways to support folks who are having mental health issues. In fact, Yeji, as you know, Aspire offers the very helpful Aspire Connect mobile app. I suppose we couldn't go forward with also mentioning employee assistance programs. Employee assistance programs offer counseling, support, resources, and referrals for employees and their families, and they are a very accessible way to get started. Another type of resource category, I should say, are what I call community-based resources. They vary from community to community. They include mental health clinics, hospitals, community centers, variety of agencies that can provide resources and referrals uh, around mental health issues. And people who are of a faith tradition may also begin their journey to getting assistance through their spiritual advisors. Now, another important thing to mention when we talk about mental health are crisis situations, and there are many different crisis response hotlines. And in the US, ours and probably the best one to call out is the National Suicide Prevention Lifeline. And it can be reached now very simply by dialing only 3 digits, the 988. So it is the 988 number, and that would be a great uh, crisis intervention type of resource. So, if I could summarize all that, Yeji, I would say that it's important to remember that seeking help for mental health issues is a sign of strength. There are many resources available to help people. And if you're listening to this, and if you or someone you know is experiencing mental health issues, please don't hesitate to seek help.
Thank you, Norman, for being with us. That concludes today's podcast. Thank you for listening.